So our next session is Family Matters, one of my favorite TV shows, Pediatric Patients Care Transitions and Family Planning. And to moderate this session, I invite Dr. Varun Kannan to join me on stage. And our panelists are Dr. Melissa Wright, Jade, who is Jayla's mom, and Beth and Lily. Come on up.
Testing. There we go. Afternoon, everybody. My name is Varun Kannan. I'm a pediatric neuroimmunologist. I have the pleasure of working with Dr. Grace Gombolay in the Emory and Choa Pediatric Neuroimmunology Clinic. I went to medical school here at Emory, and I took a little detour to Texas for 6 years to finish my training, and I've been back here, back at Emory for about a year. So I think you've already heard from everybody up here, except for Dr. Wright, so maybe we can just do quick intros one by one.
My name is Jade Brabham. I'm the mother of Jayla Chapman, who just came down off the other panel. We're from San Francisco, California. We now live here in Georgia, and Jayla fell sick in December of 2020 with NMOSD.
I'm Beth Lowry. I'm Lily's mom. You've already heard from us, and we're here from Atlanta.
I'm Lily. I'm Lily.
And I'm Melissa Wright. I'm a pediatric autoimmune neurologist, and I practice out at the University of Utah.
Okay, so this session's called Family Matters, and I think it's kind of an intentional double entendre. Family is important, and also there's some family-specific issues, especially in pediatrics.
I'm so sorry. I forgot Dr. Gombolay is going to join you too.
Okay.
Sorry.
Come on up, Grace. So part of being a pediatrician, a pediatric specialist, is obviously we love kids, but to do this job well, you also have to love working with families, which means, especially in the context of a new diagnosis, we are really having two conversations in parallel with the child and their family, and we're trying to get everybody to understand at the point that they are ready to understand. So I was hoping to hear from everybody going down the road. When you remember back to the initial diagnosis conversation, how did that happen? And how did you kind of plan through that as a family?
First, Jayla was sick when she had experienced a lot of sleeping. That was like the number one cause. And then the acid reflux. Jayla skipped the part. We went to the emergency room, and I was really stressing. Like, my baby is not waking up, She's sleeping so heavy to the emergency team, and they were really overlooking me. Like, I was, being exaggerant about the situation. And from there, that following week, Jayla really started experiencing not being able to see. But she had a friend over that had glasses on. And so as a parent, as they downplayed that to me in the emergency room, she just maybe have the flu and, just let her rest or whatnot. I started going, oh, Jayla, you don't need no glasses. She just have a friend, and so forth. And so as the week started to go on, the faster the aggression of her illness started to take place. Like in 4 days, she was like, turn the lights off, kind of feeling around, stepping on my heels in the store, like a lot of things like that. And I said, this is not normal. Fear came around. I said, open up the front door with the key. And she couldn't get the key to the lock. And so I said, this is it. Fear as a parent came over and I said, you going back to the hospital. But I took her to the eye doctor. And that's when she said, the eye doctor said, oh, she can't see. Take her to the specialist. And from there, he said, this is something neuro. Take her to Children's. They're waiting on you. When we got there and they diagnosed us, because we have other family members with MS. I'm a lupus patient. Mm-hmm. And with discoid lupus, not systemic, but there are some autoimmune diseases in the family. And they started going through the history. And when they came back, the first neurologist that came to see us in the emergency room said, she has something called NMO. And I'm like, what is the NMO, And he tried to explain, but of course, my understanding on the matter was really slim, And they wanted to start doing all this aggressive treating to her. And I just looked at Jayla and was like, what do you want to do? And she was, and at the time, the Mayo Clinic was being slow because of COVID was going on at the time. And so it's like, we can't get nothing back in time. We have to make some decisions now. And Jayla said, what would you do? This was you. And I said, take the treatment, And she did the IVIG, and it just went from there and everything. It was within a week that she got diagnosed from being sick at the emergency room.
Yeah, and in a way, I think that's a really mature reaction on her part to say,
Yeah.
I trust you and your judgment, so help me
Yeah.
make this decision.
Yeah.
What about y'all?
Yeah, Lily was pretty young when she was diagnosed. So she was 11, and the time to diagnosis, as I said on the last panel, was pretty quick in the NMO world. But because she had such severe incontractable vomiting, and she was having so many issues with swallowing, that she was really not really kind of showing symptoms of typical NMO, if there's such a thing. And so, it took a long time for even her dad and I to really accept some of the doctors were telling us, well, we're going to do a lot of testing. This could be one of the potential outcomes. And we're like, well, she's not having any issues with her eyes or with paralysis. And so when we got the diagnosis, we were pretty shocked. And, I would say that, in the first, 24 hours of that diagnosis, there was, just a lot of just emotion around, now, she's been diagnosed with an incurable disease. And I believe there's going to be a cure too. I really do believe that in her lifetime. So, it's just kind of been a sea of the unknown. And, as time has gone through, we're 5 years into this, her life is complicated, but it's also very normal in a lot of ways. But that initial not knowing, and then also kind of the first year, I was certainly very fearful of relapse and not knowing, would these medicines work? Would she have bad reactions to them? What does that look like? And so it's been, it's still a journey. It's still one that, it's great to just lean into life and be, quote, normal, but always being on alert for signs and symptoms of maybe the medicines aren't working. And, it's as we've been through the journey, I mean, she's got some secondary health issues that have come from the rituximab. And so those become a little bit more in the front, and the things that we have to deal with today that are, not great quality of life outcomes. And so that's hard. But at the age of, close to 17, it's encouraging to hear and learn about, other medicines and things like that to have a better quality of life outcome.
Yeah, I think like it's hard to see your parents in that state, especially when you're young. So it's like I kind of did the medicine so my dad wouldn't like kill the nurse. So yeah, but it was definitely hard seeing my mom and dad like in that place. But like once I got the medicine, it was kind of just easier to like to calm them down and say like it's gonna be okay, like I'll be fine.
So for our doctors on the panel, how do you go into that first conversation? What sort of mindset do you have? What sort of plan of how to disclose that information to the parents and the child?
Yeah, I think it's really interesting hearing your perspectives because I think one thing that I always try to remember with these patients is that the majority of them, as you guys have expressed, is that it's a bit of a diagnostic journey, whether that is, a week or 2 weeks or months or, however long it may be, it's still a diagnostic journey for everyone who goes through this. And oftentimes, families are told or patients are told other diagnoses before they receive the diagnosis of NMOSD or MOGAD. And so I think what helps me is going into it knowing that they have been through this, knowing that they have had these diagnoses thrown out of, oh, this is just migraine, or it's a GI issue, or it's whatever it might be, or even patients who are told it's MS, and so I think knowing that families have already been through a whole lot, and trying to understand that. I think you also bring up a really good point of making sure that the way that we explain the diagnosis to families might be different than what we explain to patients, and making sure that they are both included in that discussion so our patients understand what's happening to them, why they're getting infusions or medications, what symptoms to expect just as much as the parents do. So really trying to incorporate, I try to incorporate the kids that I treat in those initial conversations. And then I think one of the things that has been the most helpful for me that I've started, doing over time is really making sure families know that that initial conversation is not it. That's not the only time we'll talk about the diagnosis. That's not the only time that they'll be able to ask questions about the diagnosis. It's not just on autopilot after that point. So I often tell families, this is a lot of information right now, and I don't expect you to remember any of it. And I expect you to ask me questions, the exact same questions again when we're in clinic, and maybe multiple times, because it's so much that you're processing right now. And we see people in the hospital at their hardest times, and so we're understanding of that sometimes that disclosing that diagnosis or talking about that diagnosis is not just a one-time event.
Yeah, I agree with what you said, Dr. Wright. I think for me, what I sort of think about, also depends on the situation. I spend some time in the hospital, and so I actually happened to be working in the hospital when I first met Lily. So I remember delivering that diagnosis. Lily, you're still pretty sick in the ICU at that time, but when I told her mom the diagnosis, I remember, and I brought in a computer to show her the pictures, the MRIs. And I offer that option to patients and families and most people want to see it. I have a couple of people who are like, no, I don't want to see my brain. But it's really much easier to show what's going on the pictures on the MRI than to say, oh, we see these bright spots. They're called lesions. What does that even mean? They're what, So that's what I try to do. And so that's number one, is trying to give them as much information as I can. And then on the flip side, when I'm in the clinic, for the most part, when I'm seeing patients in clinic for the first time for me, they kind of have a sense of what their diagnosis could be. They've been to the hospital recently for their first attack. They've been told, oh, you could potentially have these diagnoses. Or in some cases, they're like, we think you probably have this, but we need to wait a couple of weeks for these confirmatory, especially the antibody tests, to come back. And so for those conversations, I approach a little bit differently because I know that Google is out there. There's a lot of online resources. And I know a lot of patients and families have been researching and looking before they come to my visit. So I actually walk in, I introduce myself and Gwen, because Gwen's usually with me. And then I say, okay, what questions do you have for me for this visit? And for some people, they're like, I want to know the antibody testing right now. I want to know the MRI testing right now. Or I want to know what diagnosis is. To other people, their first question will be, am I going to die from this disease? And so that's my first question. And even though we haven't formally talked about a diagnosis, I don't know exactly all their symptoms, right? I read their records. I might have a sense of what happened, but I still like to hear that from the patient at that first visit. But I don't go into all that. I want to make sure that I understand what the patient and family wants to know in that first visit before we go into, okay, here's your diagnosis, here's what it means, here are treatments. And so that's kind of how I approach it. Depends on the situation.
Segueing from that, how soon after that first diagnosis conversation did you kind of let it settle and then start researching on your own?
It was during the time COVID was going on, and we were separated from the family. It was just me, my husband, the baby, and Jayla in the hospital, and it was a bit overwhelming. But it wasn't until I got home, and we had got home maybe 6 weeks later, after being in the hospital. And I was gonna say, I watched one video of a young lady who had NMO, and she was giving her life story or whatnot. But after I watched the video, I said, this is not gonna be Jayla's story. I'm not gonna watch any more videos. I'm not gonna research anything else about other people and what they're going through, because Jayla's young. She's not that age. I started reasoning on different matters when I was scrolling through the phone. And so I just been taking this journey. What it is, Jayla make it seem so easy. I didn't realize how sick my child was with this NMO, because she does so good. She have symptoms and things of that sort, and we've been back and forth to emergency and things of that sort. But I'm letting Jayla and our family have her own story.
Fantastic.
Yeah.
Yeah, I am a need to know person, and I wanted to know Lily's future right away, and it's just impossible. And I'm glad I sort of just let go of that desire to kind of know the 20-year plan, and just kind of stayed present in the here and now, because her health outcomes and where she is today, while it's not easy, is far better than kind of what I imagined at that moment in the hospital, for sure. And for her, because she was so, so sick. I mean, she was, she was throwing up 20 times a day, and she just was so ill and lost so much weight. She was 50 pounds coming out of the hospital. It just became, once she got out, it was just the beginning of the summer. So just to kind of get back into normal life, kind of let go of all that research. The first thing we did is we took a trip to Beverly Hills because she loves to shop. So that was really fun. But, we just had to kind of slow down. We were so, blessed that, we met Dr. Gombolay in the hospital. So she was our person for the journey. And so just to get on the rituximab, get through that, initial kind of, is this going to work and how's she going to react to it? Yes, this is working. Let's move on. And then, it wasn't easy. I mean, my heart goes out to y'all going through this hospitalization during COVID. I mean, then she had to go on to online school, right? And because of her health condition, we were even more careful with COVID. And so then we had that challenge of, a kid in middle school missing, basically the socialization of an entire year. So, it just is what it is. And we've just learned to sort of suspend trying to look at that 20-year vision and just stay in the here and now. And in every step of the journey, she's done better than what I could have imagined with, the sort of research and things that is out on the internet.
And anyone who has NMO knows it's for me, I feel like it's still going on. I still have to do infusions or whatever, but you can't just stop living and let it dwell on it. So and I think my when I got out, I was so excited. I ate everything because I was so hungry.
She had a Whopper the first minute she got out.
But I think for me, my family was more freaked out than me. I was okay, whatever. But I think for parents, it's just kind of you just have to let your kid have fun and be them.
You touched on school a little bit, and as pediatric neurologists, school is such a big barometer of how we gauge how well our patients are doing. It sounds like both of them had pretty long hospitalizations that clearly affected their schooling at a critical age. What was the transition process like getting back into school after the hospitalization?
I was kind of a nut when it came about because I didn't want Jayla to go to school. I was like, no, stay home. And she said, no. She said, no, I'm not staying home with you. She did. She's like, oh no, Mom, this is going to be so hard for me. I totally have to go to school. And I'm like, please, baby, you sick? She's like, no, you're going to be around all the kids and it's COVID. And Jayla looked and she said, socially, being in the house, I played the tuba. I wanted to do, I played the instrument. I want to still do marching band. That's part of my life. And I need that for my therapy. And I said,
that's a lot of insight.
Yeah. I said, you know what, babe, go to school, wear your mask and just do what you need to do. And she did that. And she did not get behind. This is her last year. She'll be 17 come September. And she caught up on all her work that she missed. And she worked whatever out she needed to work out with her teachers. And she's thriving in school. She's doing well. Yeah.
Yeah, it's been kind of an interesting journey, So Lily also, she's, diagnosed with dyslexia and dyscalculia, and it was very interesting to get the neurological psychiatric evaluation for educational needs. And so, there is some correlation to some of these, challenges. And so it's been a bit of a learning journey to figure out, in addition to, having a lot of doctor's appointments and missing a lot of school, especially, when she's got secondary infections and things like that. And then also on top of that, to just, her brain learns differently and just finding the right educational support so that she can thrive there. And so, and it, again, it was really, really tough to try to do virtual school for almost a year when you have already all those a lot of learning differences. And so school is definitely not Lily's favorite thing, but she's a rock star and she gets through it. And, we'll see what's next for, secondary education after high school.
Yeah, I actually kind of liked online because I could cheat, but it was it was hard to be inside with my mom all day because it it was just like a lot, and my dad like closed the pantry because we were eating so much. But it was definitely hard for like my mental health just to be inside all day and be away from my friends. And I was in 7th grade, so it was kind of like everyone changed, and it was just like a lot. So like when I went back, it was definitely like better, and I felt better like with NMO and stuff like at that point.
I really appreciate the honesty. So for this question, I'm going to start with the docs. So one of the challenges that we have in pediatrics is we have one FDA-approved treatment for pediatric MS. We have none for pediatric NMOSD and none for pediatric MOGAD. We are using off-label therapies that can still be quite effective and safe, but again, they're off-label. So from a doctor standpoint, how do you start that conversation with the family, trying to build the trust and say, hey, I know this is not FDA approved, but I think this is what's best for your family and your child?
Yeah, I think the way I approach it is just being very upfront and honest about it, because I don't want them finding out other ways. I want them finding out from me. And so very clear at the beginning where the research is at in a way that patients and their parents can understand. And when I say where the research at, where our very limited research is at in terms of in pediatric patients. And I think those can be hard conversations. And oftentimes I explain the process of, it helps to explain the process of FDA-approved medications and how that comes to be and how clinical trials are needed to help support that FDA approval and how challenging it is to get pediatric patients, get clinical trials for pediatric patients. The other thing that I sort of do at the sort of initial therapy conversation and diagnosis conversation is just let them know how new this field is. And, especially talking about when the MOGAD or the MOG antibody became commercially available and how this is an evolving field and it will continue to evolve, and just let them know that I'm aware of that. We're in this journey together, and that we'll be going through how I practice now and what treatments they're on now might change in years to come because the field is really evolving.
Yeah, I really like that. And I think the other thing that I sort of mention to my patients and families is that we don't have a lot of research right now, but I'm going to write that in all of my notes, in the appeal letters, and my peer-to-peers when I talk to the insurance company to try to get this approved. And I warn my families, because now everything's open notes, so you can read your doctor's notes. I will say, this patient is at high risk for severe neurological disability and or death if you don't approve this. And that usually works. But I use those words because it actually is true. Like, I'm really glad to see how well people are doing, but at the same time, that's unfortunately the reality of these diseases. And that's what I want the insurance companies to realize, that thing can actually truly happen. The other thing I find that's really powerful is something called anecdata. And what that means is that we have all this research, we have all this science. I'm a scientist, right? This is how we do. And that's the whole goal, is to have the best science and studies and all this stuff to show that this actually works in people. But at the same time, there's something very powerful. And I think hopefully we've seen this today. We see this all of the time, is each patient's experience and their story. And so even though when I have some patients and families and they're a little reluctant to try X, Y, or Z, or they're really reluctant to try this medicine, or to, for example, get a port placed for their IVIG because they're little and they have a hard time to get access to, fortunately it takes 5 sticks before they can get IV access, all of those things. When I say, I have other patients and families who have gone through the same struggle of making this decision, and they've given me permission to connect you with them, or why don't you go online into these resources, connect with these other families, see what their experience is. And even as a scientist, as a physician that knows this data, that looks for this data, and we still need this, these studies, at the same time, I find that that experience is quite powerful, and that can help with sort of helping families understand, okay, these treatments are what we should be doing.
From a parent standpoint, were you all nervous about off-label treatments?
No, we just wanted Jayla to get better. I didn't even focus on any of that, and I think this was the best treatment she get, Rituxan infusion or whatever, and they gave it to her at the hospital. I just feel like the side effect of the medication affected her later when we got home because she went into a very bad depression. Even though the medicine worked well for the symptoms, it caused other things to happen. And then you had asked earlier about how it affected the family. Well, anytime anybody's diagnosed with something this, I don't know, give it a name, but like this, it sent the whole family, the other kids in the family, we were all affected. I didn't even think about it. And I was just trying to keep life normal in the household. And the me trying to be normal really made a different emotional effect on everybody else in the house. I have other children in the home, and it didn't really turn out as well as I thought. Trying to just be like, okay, this happened. Let's just move on. Let's just take care of Jayla and just make everything. No, no. So it caused everybody to need mental health help from some specialists to talk to everybody, and that's important. I think as a parent. The emotional side of anybody being diagnosed with any kind of disease in the household, at that point, everybody should get help. And that was the hard part. The medical part, going through the diagnosis and all these things was great. But when it was time to find mental health for the family in our community, totally sucked. That's what I can say.
Thank you for sharing that. That's a very important point.
Definitely.
Yeah, for us, same. I wanted Lily to just get better. I had a lot of trust with Dr. Gombolay that, this is such a rare disease. There wasn't any, at the time, there wasn't any FDA drugs approved, period, for adults or for children. And so we were just really grateful there was something that was available that potentially could prevent her from relapse. And then again, after we got through the first couple of doses, and then she had, really zero issues from her, from the infusions of the rituximab, we built trust with the medicine too. And so the harder part has been insurance. My God, don't ever change insurance when you have these rare diseases. It's awful. It just takes a long time. And that's when the Gwens of the world really come in and she's a bulldog. She'll get those insurance companies whipped in shape and get your infusion if you need it.
All right, we got a little under 3 minutes left, so we'll take some questions.
So this isn't a question, but I wanted to comment to you guys that you guys all did amazing. And TSF has Voices of NMO and MOG. And I really am inspired by all of your guys' stories here today. So I encourage you to submit your story to TSF, patient, caregivers, clinicians. We want to hear from all of you, and I just am so thankful for you guys being so vulnerable and sharing with us today your story. So I know Jayla's mom's up there. We want to hear your story. So sad that to hear that we're hearing a story that wasn't so great, and but your story's amazing, and we want to get your stories. So submit them to TSF. We want to have them. Thank you.
Hi, so I have two questions. My first one is for the moms on stage. What do you guys do to practice self-care, and what would you recommend to other parents who have newly diagnosed children?
Allegate other people to do other things. This last appointment, Jayla went on for MRI. MRIs are a very long day for us, and very stressful for me. Different. I don't know how Jayla feels, but at the end of the day, because she still is getting medication to be sedated and so forth, and she's bigger, it's a little draining for me. So I designated someone else to take her this time. Yeah, I think that it's important that you allow other people to play a role in taking her to the doctors, going on appointments, taking her out, doing other things to give me a break, because I also have the little 4-year-old you see around here. And so as a parent, I take on a lot of, I'll do it, running around when it all started. But now I'm just like, I was invited to camp, and I think that's another great resource if you guys can tap into doing that. But Dr. Gombolay and Ms. Carr back there, they put something together. We went to camp and I learned about self-care. I didn't know the strong being too strong and so forth. And that was one of the things they suggested. And I took heed and I did it this time and it felt great. I was glad I got a break. Yeah.
Two quick things. I'm a deeply spiritual person, and so when Lily was in the hospital, and even the first year after she got out, I mean, I just had to turn it over every day. I just had to remind myself that we're on a journey together, and I'm her mom, and I support her, but it's to get her to learn how to advocate for herself. But I don't know how I would have got through it without faith. And then the second thing is I am a nut for a good sleep, and I just really, really prioritize good quality sleep in my life. It's not always easy, but that's a big, big piece of what I do for my own mental health. I try to exercise, I try to eat right, but I just really try to make good sleep the top of that list for overall self-care.
My second question is for Lily. I just want to know, how did you navigate telling your friends and building a support circle and telling them what it is you go through, and were they receptive of it?
Well, like for me, like I think I first told my friend that I have NMO. I was like, it affects my brainstem, and she was like, "Do you have cancer?" But like it was really difficult telling my friends when you're like mentally not in a good place, because it's kind of hard to explain to them like the trauma aspect of it. So like I guess like telling your close friends like they really understand it, and like just telling them that like it's a hard time, and like just like supporting you and stuff is like really helpful.
Okay, so I have a question. This is for for Beth. So I know when going to the hospital and stuff, my mom working was a hard time because sometimes she will have to leave me in the hospital to go to work. Thank God her job was right next to the hospital at the time. So what is your career, and how do you stabilize your job and taking her to the hospital and staying in the hospital where, because I know that was a big thing for us as well.
It's really hard. I work full time. I'm an executive president of a construction company, which is kind of odd, but I am. And I have a high demand job, and I was very, very, very blessed that I had I've been with the same company for 29 years, and they knew that I just had to step out. I had to be the full time caretaker of Lily. It helped that my boss was also the chair of the hospital, so he had some connections and was able to but he was able to also realize I was going through a big deal, and so I was very, very fortunate to have that, and it gave me a big heart and some passion for how many people in our community don't have the ability to step away from work, and I've tried to advocate and partner and support in any way that I can for more resources out there to help families that are going through long-term care needs, because it's really, really taxing, and it can be devastating financially for a lot of families.
Hello, everyone. My name is Sydney. I wanted to direct this question to Lily. I as well went through a tough time in school with I had a lot going on. It was hard to let me start. So after I got out of the hospital from Scottish Wright, and I had to enroll into my senior year in 2021, everyone noticed that when I disappeared for a long time, and no one knew what happened. So when I had to go back to school after online ended and we came back from all the COVID pandemic stuff, everyone questioned why I look different, why I gained weight, why I speak different, why I have different, why just everything was different. And it's hard to explain that, well, because I had lesions growing on my brain. This is hard to explain. So I simply said my immune system attacked my brain and some octave nerves. But they were like, what does that mean? And then they would look it up and like, you have cancer? I'm like, no, that's not what I said. And it was kind of hard to explain it. So I get it. I also get it. And like, it's hard to explain. They're like, how was it in the hospital? I can't really get into detail because that's when you tap into like that trauma aspect of like the whole situation that me and my mom went through and like my whole family and stuff. So yeah, I understand as well. And I'm glad that I'm here today, how I am now. Like, I'm able to, I'm normally speaking out loud now and stuff. And I would like to thank all the nurses and doctors and like, hi, Dr. Gombolay. Hi, Gwen. I love you.
Okay, I think that's a fantastic note to end on. Just how about another round of applause for all of our families here? It's not easy to share, and we really appreciate it.